Hi, my name is Randy. I'm Chief Technology Officer for VDI Laboratory. In this presentation, we're going to talk about osteoarthritis. It's a marker that we have for it. It's something that is a chronic disorder. When it happens, when animals start going lame, there really isn't a whole lot you can do other than keep them comfortable. But wouldn't it be nice if we could detect it early so that there is things that we can do to help slow the disease progression? All right, and that's really what this is about. So let's talk about osteoarthritis and what it is that we're doing. So when we think about degenerative joint disease, which is really the context of all of this, here's your capsule. And inside the capsule, of course, is synovial fluid. And when that capsule begins to degrade, what leaks out? Synovial fluid leaks out, goes into the bloodstream. And what we have done is we've developed a test, hyaluronic acid, which is a major component of synovial fluid, and we detect the level of that within the blood. Now, serum HA has a very short half-life within the body. The liver chews it up like crazy fast, within like 5-10 minutes. It's really fast. So if it's accumulating in the blood, that means that there's ongoing active leakage of synovial fluid into the body. And that's why it becomes a good marker for degenerative joint disease. Now, you certainly want to be doing this on pets that are like under 1 year old because they're growing. And HA is also part of the extracellular matrix, so we don't want to be measuring that. But once you have a dog that stops growing, and why would we want to test a young dog anyway? And cats too, by the way. And they're older and everything's stable, then the serum HA levels are truly reflective of what's going on within the joints. And then when it gets above a certain level, like which is demonstrated right here, then of course that is corollary to excess leakage. We have a capsule that's leaking, and then there's things that we can do about it. It does correlate nicely with various types of degenerative joint disease, degenerative myopathy, osteoarthritis, IVDD. All of these things will have elevated levels of even an ACL tear, for example, that will do it as well. All of these things will have elevated levels of serum hyaluronic acid. So now if we took a look at stages, because there are stages of things, and we think about the cutoff. So here's the cutoff at 20 nanograms per milliliter, which is within the normal range right here. So animals just fine. Then there's a stage when things start to begin, and this is really what is occult disease. And this is really, hopefully, the sweet spot that you're able to identify, sort of in this zone right here. But then as early stage, maybe not yet visible, starts to occur, it starts moving up this level of HA levels. Somewhere in here, clinical signs are going to start to be somewhat evident. And then certainly when we get into sort of moderate levels, it's going to continue to be evident. Now, you'll look at this curve of HA values, which this is what's on the y-axis here. So at moderate, it kind of like peaks out. And then at some point, what we'll call late stage, when it starts to, the animal's really, it's very painful and they can't move very well. What's happening is there's no more really cushioning effect within the joints. And now you're getting basically bone to bone. You're destroying the chondrocytes within the joint itself. And these cells no longer are producing any synovial fluid. Okay, so before they were like trying to produce some synovial fluid to lubricate the joint and do whatever. At some point, their ability to produce synovial fluid just begins to just tank. And it just goes back down. And literally, in more advanced cases, HA values will even get back to normal. But it's not normal. I mean, you can clearly see that from the stage of the animal. So it does follow this kind of curve. What we would like to do with early stage testing is really to get them more on this side of it so that there's things that you can do. And if we think about inflammation, in the early stages, there really isn't a lot of measurable inflammation. It doesn't really drive the serum level of CRP that elevated until it really starts getting to be sort of right about here at the moderate levels, and then certainly in late stage it begins to go up. And now that will be different than IMPA, which is immune-mediated disease. So it's an autoimmune disorder, in which case this can also be a sort of a help to be a differential diagnosis for IMPA. Why? Because serum HA levels will be elevated and CRP will be peaking as well because it's an autoimmune. That's only in IMPA. But all the other types of degenerative joint disease will not be the case because there's not an immune response that's occurring in these particular cases. So if we take a look at it, so here's the chart, sort of normal, everything's normal. Early stage, HA is elevated, CRP is still normal. Late stage, you can see that it begins to rise as we shown in that previous diagram. IMP, as I indicated, it is an autoimmune disorder. So it causes inflammation to be quite elevated, and you can see that. So it helps to differentiate between these diseases. Degenerative myopathy, IVDD, typically tend to be normal, but there can be situations where it's just a slight level of increase in inflammation. And of course, if there's any acute injury, like a tear, well, by definition, it's acute injury. And so there's going to be a strong inflammatory response to repair it. And then during that repairing time, expect HA values to be high, expect CRP levels to be high. So depending upon what's going on, please understand there's going to be different levels of inflammation in serum HA levels. We do have a nice compendium of the published studies in this space and how everything works, which can be obtained at VDILab.com's resource center. Now let's talk about treatment. Of course, Adequan is certainly something that's been out in the market for quite some time. This is actually from them. PSGAG, which is polysulfonated glycosaminoglycan, which is the component within that product. And as it discusses here, you know, it helps to prevent further degradation of the joints. It reduces inflammation. It inhibits degradative enzymes, particularly of synovial fluid and HA. And the last piece right here stimulates the activity to produce more synovial fluid, which is what we saw earlier. Remember, I told you in the treatment phase as it kind of goes up. So when we see that here, you can see that during treatment, it will actually rise. So if you ever give Adequan at any stage here, I mean, if you give it right here in the middle, it's going to, you know, it may rise up as well. Depends on where you're giving it. But that's what it's doing. So when you give the medicine, don't be surprised, actually expect serum HA levels to increase because that is what the medicine is actually doing. It's increasing synovial fluid, increasing the lubrication of the joint, which is what you want. It increases mobility, reduces inflammation, reduces pain. And so the serum levels go up. So it's important to understand where you're at in terms of clinical stages, what's going on. But when used with this understanding, serum HA levels become incredibly useful, particularly in occult and early stage, so that there's action that can be taken to help slow the progression of the disease. So I hope that serum HA levels for osteoarthritis, IVDD, degenerative myopathy might be something that you might find useful within your clinic, and VDI is here to support you. Thank you for listening.